Welcome to the elbow and forearm lecture. This has nothing to do with the elbow or forearm, but it sure looks good. All right, so as we've been doing in most of our lectures, I'm going to talk about the elbow and forearm anatomy and talk about some common injuries for that area of our body. So, our anatomy of the forearm, our bones, we have the humerus, which is an extension of the upper arm. Then we have the ulna with the L, big L there bolded to help you remember where it's located. The L is on the lateral side, or the little fingers, or it's actually on the medial side, on the little finger side of the forearm. So if you go to your little finger and follow it up, that's the ulna. And then the radius is on an anatomical position, that's on the thumb side of your forearm. Then our elbow joint is between a humerus and a radius in the ulna. So it's got three bones together there. And then it is responsible for elbow flexion and extension. And then the forearm joint is kind of a different joint. It's because it's where the ulna and the radius cross each other. And here's where we have pronation and supination. So if our elbow is at 90 degrees and our hands are up, and we turn our wrist over, or actually that's our forearm turning over, like we're pouring a drink, that's pronation. And supination is when your hands are up. That's supination. So the bottom picture there is pronation, and the upper position is supination. Some muscles in our elbow and forearm. Elbow flexion is done by the biceps brachii. Elbow extension is by the triceps brachii. Forearm pronation is done by the pronator teres. And the forearm supination is by the biceps brachii and the supinator. So on the next couple slides there's a lot more muscles in the forearm, in the hand, and the elbow that I'm going to go over. So this is just more for your interest, just to see all the different muscles that happen to be in our forearm, wrist, and fingers. Last part of our anatomy is the olecranon. Just looking at that, you think it would be Olecranon, but it's Olecranon and bursa. And remember that bursa is a fluid-filled sac that reduces friction. So this is located between the tendon of the triceps and the olecranon process. The olecranon process is what you would generally think of as the elbow. So that's where that's located. I just said that. Olecranon process is what we think about the elbow. Next, we're going to talk about how we can prevent some injuries here. Oops, I should have removed the wrist injuries. We're just going to talk about elbow and forearm here. Protective gear is always recommended to reduce severity of injury. So that would be elbow pads and forearm pads and all those type of things. Chronic injury reduction is limit in baseball and tennis, limit repetition, especially with younger athletes. We'll talk about tennis elbow and those type of things. Make sure that the person is using the correct mechanics. So if they're throwing incorrectly or hitting tennis racket is gripped incorrectly, fix those things. And the equipment should be for the skill level of the person. So don't give a youth athlete a high school athlete sized material. It's just, again, common sense. And with all our body parts, maintain appropriate levels of strength, flexibility, endurance for the activity that the person is competing in. So that's making sure that we have appropriate preseason, in-season, and postseason strength and conditioning programs in place. Our first injury is Olecranon Bursitis. So this can be a chronic or it can be an acute injury. So a chronic is from repeated trauma to the elbow or mismanagement to an acute bursitis. Typically, what will happen is with an acute bursitis, Olecranon bursitis, somebody falls on the elbow, or poor mechanics, they're throwing it and with overuse. Signs and symptoms for both. His elbow has deformity, looks like a ball is on the elbow, and because of that we have decrease of range of motion because of the swelling. Can't extend your arm all the way out. And so the easiest way to take care of this is the aspiration by a doctor. As the picture shows, they take a needle, put it inside the bursa and suck out the blood and swelling, and that's the easiest way to take care of that. Okay, epicondylitis is an inflammation of the muscles that attach at the medial and lateral epicondyles of the humerus. I've had this. This is very painful and debilitating. So we have medial epicondylitis. This is also known as pitcher's elbow, little league elbow, racquetball elbow, golfer's elbow, or javelin thrower's elbow. So the mechanism injury here is overuse of wrist flexors and forearm pronators. This sounds like a really good test question. Then we have lateral epicondylitis, also known as tennis elbow. Here we have overuse of wrist extensors and forearm pronators. So our signs and symptoms for both are pain at the epicondyle and pain with active range of motion and passive range of motion. Again, I've had this, very painful. Use anti-inflammatory medications, Advil, Aleve, those type of things. Rest heat before and after. Tape or forearm straps also help. I actually had to get cortisone shots, a couple of them, to get it to finally calm down and go away. And our last one is elbow dislocations. Hyperextension due to a fall in an outstretched arm. Severe pain. Deformity of the posterior elbow, depending on the severity, splint, ice, and get the ER. And we got to check the distal pulse here. Okay, that's really important for this. I've seen this a few times in wrestling, so it does happen in athletics. So what's wrong with that? Let you think about that for a little bit.